Hey everybody, before we get into today's episode on boosting case acceptance, I want to give a quick shout out to Velemeni. Velemeni is an AI platform that combines 2D and 3D imaging, VR, voice charting, and real-time claims into one seamless workflow. Everybody, it is conversation time, and not just any conversations, but intelligent conversations. I am Brandon Hill. I'm here with my esteemed partner, Dr. Kathryn Alderman. Kathryn, how are you today?
Good. Hi, everybody. We are having intelligent conversations today, bringing AI to dentistry.
I love it.
And today we're going to talk about case acceptance.
Yes. You know what? Let me just say thank you for keeping your promise. You promised me in the last episode that this episode would be about case acceptance because that's near and dear to my heart. Because as a consultant and somebody who helps business owners, especially dentists, nothing is more important.
Nothing is more important
than case acceptance. It's the lifeblood. That's what it's all about.
It's all about
everything that you do as a dentist is to lead up to that patient saying, yes, take out all my teeth. Give me 32 new ones, or at least 28. Is that how you do it?
I don't understand why we always talk about systems and operations and improving flow of our dental offices, and case acceptance should be number one conversation. Number one conversation.
It's where everything is leading. Everything we do, all roads lead to case acceptance. That is why you have a business. I'm not going to say that's why you became a dentist. That's a little caveat there, but that's why you have a business.
But it is why you became a dentist, because we become a dentist to help patients. We go to dental school because we want patients to have a beautiful smile, healthy smile. And truly, case acceptance is an art. Case acceptance is everything. It's how our team interacts with patients. It's how we talk to our patients. It's how we educate our patients. It's everything.
Yes, it is.
Everything, every successful office really has a high case acceptance.
And there are different roads to get there, meaning how you create case acceptance in your office will be different than how another dentist does, because your personality is different. The vibe and theme of your office is different. Your staff is different. The why and how you do what you do is going to be a little bit different, but there needs to be a path to case acceptance. So let's get right into it. Intelligent conversation about case acceptance. And I want to start off just talking about what case acceptance is and has been, and what it can be. So just break it down for people. What is case? I have a word for it, but because my word might be different than yours, but what do you consider case acceptance?
I'm glad you asked, because case acceptance is ultimately for patients to complete the needed treatment plan. But here, why it's different, because most of the dental disease does not hurt.
Right.
If you think about it, gum disease, cavities, 80% of what we treatment plan every day doesn't hurt.
Right.
And also, dentistry is very expensive. Most dental insurances have limited or no coverage for the needed dental treatment. Some patients don't even have a dental insurance, but ultimately, all dental work feels expensive to patients. Now they don't have symptoms, and ultimately they don't feel that they need this work. They don't trust the dentist or hygienist when they tell them that they need dental work. So treatment and a case acceptance in dentistry is always lower, because patients don't trust that they need it due to lack of symptoms and due to the fact that they simply don't see it, combined with the expense of the dental treatment.
That is such a fundamental issue with any product or service that is sold anywhere in the world. Pain sells, and avoiding pain sells, but pain sells. So if something's hurting, no one cares about how much it costs.
You got it. Got it.
So for dentists, like you said, 80% of the time, it's not hurting. You've got to create an environment where people actually want to prevent the pain and not just solve the pain.
And they can trust that it needs to happen.
Right.
So you nailed it. That's exactly. So that's what offices that do have a high case acceptance, they will have a high case acceptance even if they're in a poor neighborhood,
Right.
because most offices able to show patients their problems and educate on consequences of not fixing those problems. So
Right.
case acceptance is really the highest when patients can see that they have a problem. They become educated about the consequences of not getting those problems fixed. And that brings us to the next point, what is done today in dental offices.
Yes.
And how AI can help. So let's talk about it. What is done today?
Let's talk about that. And so, you've gone through this as a dentist, running dental offices, and, originally, I'm not going to say how long you've been practicing. We're not going to date you here. But originally, how did you handle case acceptance in your office?
So when I started dentistry, it's wonderful that I'm foreign. And some patients won't understand what I was saying. So that's really helped me to increase my case acceptance because I was forced to use visuals. I incorporated simple sentences,
Right.
visuals, intraoral cameras, and a lot of atlases. I also noticed that it was wonderful for patients to see pictures
Right.
and for me to speak in a simple language. So what I did, I actually taught a lot of dentists and hygienists to use the same principles on educating patients. So basically, use a simple language, use visuals, use intraoral cameras, and use simple words that patients can understand.
Right.
And really describe the problem, describe the consequences of not fixing the problems, and how it applies to your patient, and the solutions only at the end. Well, saying that, I know that it's not the case in most dental offices.
Correct.
A lot of dentists don't even use the visuals, don't use intraoral cameras. They just speak to patients and they explain the treatment. And so there is no standard operating procedure on how treatment is presented to the patient. So right now, most dental offices don't have a consistency in how the treatment plan is presented. Also, a big problem, what happens, the dentist actually gives a job to treatment coordinators,
Correct.
which should not be presenting treatment plans to the patient.
So so I want to put a pin there. I want to go back to that, but I want to first talk about something you said earlier that I think may have gone unnoticed, or we may not be putting the emphasis on it that we should. You did something as a foreign dentist where you took what would be a perceived weakness and you turned it into a strength. That was a language barrier, an accent barrier, maybe even a cultural barrier, and things that I know a lot of dentists are concerned about. A lot of dentists are coming, in America from all over the world. I know many of them. Dentistry is becoming more and more diverse every year. And those things could feel intimidating to someone who is, English isn't their first language, or America is not their cultural norm. And I love the fact that you knew that creating a simple system would be the easy way to not just solve your problem, but actually make it better for your whole office. So, and this is just something that I hope everybody is grasping. So even if you don't have the type of issue that Kathryn had with that type of barrier, even if you think this is going to be easy for you, don't think that you can be so good at something naturally that you don't need to systemize it. Don't think that you can be so good at something that you don't need to create SOPs, operating procedures, and have tools in place so that not only is it easier for you, but, if you ever had to train somebody or bring somebody else in to help you, you could keep that system flowing in your office. So I applaud you for that, and knowing that and taking what could have been a weakness into a strength. That's just something that I think is the key to any entrepreneur. Your weakness is an opportunity, and it actually can be a strength if you deal with that. So.
Well, think about it. We deal with the patients. We speak a foreign language to them. Remember that most patients that come to our office have a low dental IQ.
Correct.
They do. Even if
so no matter what, you're speaking a foreign language.
No matter what, you're speaking a foreign language to
Right.
them. You're speaking a foreign language. Then you add an accent on top of that, or it's a foreign patient as well. So
Right.
remember, we see a lot of foreign patients.
Correct.
All of us see a lot of foreign patients. So really, communication, clear communication is a really goal to high case acceptance. And
You're
it's really
absolutely right.
by using standard operating procedures and how we educate the patients and what we say and how we say it should be taught and really practiced as a team in the office, because case acceptance is really, it's not just what we say in a clinical, it's how we say it, but then how finance is presented to our patients as well. So I always say case acceptance is 50% from a clinical team and 50% from a financial team.
That is very true.
So now we have a whole team. Really, the way, let's talk about what case acceptance really, how it works the best. Truly, if you want a high case acceptance, I'm going to give you 5 rules.
No, let's do it.
5 rules. Number 1, patient is coming in, and if you have a hygienist should be educated about potential needs, because hygienists are brilliant, they're super smart, and patients love our hygienists. So the hygienist has more time with the patient, and patients trust our hygienist. So hygienists should be educated after consulting with a dentist and knowing what's the treatment. Hygienist should
And let me say something too, just to interject about the hygienist. Not only does the hygienist spend the most time with the patient out of anyone in the dental office, the dental hygienist is the healthcare provider that a human being spends the most time with. I mean, assuming that you're going twice a year, you don't necessarily go to any other type of healthcare provider 2 times a year or every 6 months. So the hygienist is invaluable for the relationship with the patient, because as we know, the oral systemic pathway of health, and the fact that you can fight not just oral diseases, but all diseases, obviously in the body, have a start in the mouth. So I know I did that little sidebar there, but that's the hygienists are powerful.
Hygienists are powerful. And again, we're not talking about hygienist diagnosis. No, that's not what we're saying. Hygienist and a doctor working together. Doctor looks at the x-rays, and then hygienist educates about potential things. And then a doctor coming in, confirming that and discussing that. And again, both of them can utilize visuals, intraoral cameras, and again, simple language that patients can understand. And then there has to be passing over to the financial team. We have to help patients to commit to the next step, scheduling that needed treatment. So the patient has to be clear what they need to get done and how many appointments it takes. And then a clinical assistant takes the patient up front and schedule, and the administrative team now schedules that patient for the next treatment, and then go through financial limitations and if there is an insurance. That's really your formula for high case acceptance, because now patient understands his or her needs. They have seen it visually, and now they have a clear understanding of their finances as well. That is not happening in most dental offices.
No, it is not.
No, it's not. Hi, friends. Let me take a break and talk about, to give a shout out to Velemeni AI and why. One of the biggest barriers to case acceptance in dentistry is not just a patient hesitation because of our finances. Sometimes they don't want to accept the treatment because the treatment is not clear for them, and they don't have trust towards that needed treatment. Patients can overcome that hesitation and actually say yes when they can see and understand and trust your diagnosis. This is where the right technology changes everything. AI tools like Velemeni One is a wonderful, well-developed AI platform that can integrate 2D and 3D imaging. It can actually do claims automation. It even uses VR. And it offers voice capabilities into seamless clinical experience that improves patient care and also improves experience for your team. Your patients now can see better and they can accept the treatment, but your team also has ways to communicate with patients and each other better. Velemeni AI has FDA approval for panoramic, bite-wing, and periapical x-rays. It automatically detects and highlights findings on 2D images so patients can visualize their dental need instantly, again, leading to the trust and boosting case acceptance. They also offer 3D verified checks for 60 plus anatomical landmarks in real time while the patient is still in a chair. We all been looking at the x-rays and thinking, is it something that is really there? Am I right? We all have been double guessing ourselves. And Velemeni AI helps to stop that guessing because they can highlight 60 plus conditions and verify those conditions. So Velemeni AI can give you that confidence that you need while you're seeing your patients in a chair. And patients do feed off that confidence. They will accept the treatment. And once the patients accept the treatment and trust you, it creates even more confidence for providers of any level of experience and expertise. Confidence is a good thing. Confident patients lead to more confident providers. And this helps to create a consistency in a case acceptance in your dental office. Outside of creating trust and a confidence between the patients and your providers, Velemeni can help you to do free period charting and a clinical note taking for your team. So you can focus more on a patient care instead of a keyboard. More eye contact, more connection, two keys to higher case acceptance rates again. After the patient leaves, Velemeni can help you to create real-time claim verification, means you can give patients accurate financial estimates on a spot, removing the uncertainty that often stalls treatment decisions. When patients can see the problem, trust the diagnosis, and know the cost up front, case acceptance does rise. With Velemeni One, your diagnostic clarity, workflow speed, and communication all work together to help patients confidently say yes to the care they need. Now, let's get back to the show. So,
and it's so funny. I mean, it's simple. Knowing what the problem is not as hard as sometimes implementing it and committing to that implementation, because what ends up happening is, I mean, I know our show is called Intelligent Conversations, but actually to get this done sometimes requires uncomfortable conversations with your team to kind of get them on board with how things need to be done, understanding the why, and then being able to motivate them to understand the how and then implement it. So kudos to you for understanding that and being able to do that in your practice.
Well, right back to you, because you understand those things and you're really passionate about case acceptance.
That's because I love dentists.
Exactly.
Dentists are all my best friends are dentists.
Back to you. Yes.
So we get it. We understand that these systems need to be put in place. That's how they're done manually. What is technology doing to help with this right now?
So that's a great question. So obviously, great points that you're saying, that we really should have this conversation first. Even if you bring in AI, it will not help. But AI will definitely help to have less dependence on a human team.
Right.
So AI right now can do this. AI diagnostics can help patients to see needed problems such as cavities, broken teeth, and even a gum disease using AI. So AI can be wonderful to point it on a screen. And instead of using an intraoral camera, we can use an AI to point those problems.
Right.
Sadly, patients will trust AI probably more than they will trust the dentist. So AI kind of serves as a second opinion. And again, your hygienist or even a clinical assistant can point out those problems, then a doctor can come in and confirm. So AI is not here to replace a clinical decision of a doctor. It's not. But it's here to work as a second opinion and to give that visual presentation that patients need to gain trust.
I love it. So I've said this to everyone, that I've talked to about diagnostic tools. As a patient, I don't want my dentist to not have that type of tool for a couple of reasons. Number one, it's easy. All right. It's easy for me. It makes it more comfortable for me to understand what the dentist and the hygienist is telling me and to make a decision on how to move forward and why. All right. So it takes stress of uncertainty away from me. Number two, it tells me how important it is for my clinician, for my healthcare provider to get it right. One of the biggest issues that dentists always tell me they deal with is the trust factor. Okay. A lot of patients just don't trust the dentist. And part of that is the fear factor because dentists are associated with pain. There's a lot of psychological stuff that goes into that we won't have time to get deep into today. But the result is people don't trust the dentist. Okay. Seeing that my dentist has incorporated a technology to help make them to help validate what they're saying and doing and create that trust. Just one hand is the fact that it helps. On the other hand, I'm happy to know that they're trying. A lot of people don't think about that. When you have to think about that as a business person, everything that you do is psychological and emotional. Like we talked about, these patients are making decisions from a position of not necessarily being in pain, but needing to trust their provider. And if you can get on that side of their emotional brain, that'll help them make the better cognitive decisions. So that is what I love about it. Like I said, I love going to my dentist. I love seeing that tool. I don't like seeing if there's a problem, but I love the fact that I can understand it. But if I move somewhere or have to get a new dentist, I promise you, I will be asking them what type of diagnostic tools they use or how they diagnose treatment. I won't just be, and I would never know that obviously if I didn't work in dentistry to do that and how to talk to dentists. But that's just so important to me as a patient. Think about your patients and what they want. That is how you become successful. So,
and I would like to add to that. I would like to add to that because I'm a pretty seasoned dentist. I've been doing dentistry for over 20 years. I call myself a dinosaur at this point. But I have to say that even as a seasoned dentist, that I can definitely treatment plan well and diagnose cavities. But I get tired, just like a human. I get tired if
You're
I
human?
I'm a human. Yeah, I'm a human. I'm through. I love AI. And by 3 o'clock, even by 1 o'clock sometimes, it's sometimes tough to see with x-rays.
Right.
And really, and again, we wear loops. So when we take the loops off and look at the x-rays, sometimes our eyes don't get adjusted well. So I have seen that AI diagnostics help seasoned dentists. It's almost like a second opinion. It's almost like helps me to see cavities, especially when I'm tired or I'm between hygiene patients and between the rooms and I'm taking my loops off and my eyes are not adjusted enough. And also it helps my hygienist to feel empowered. And it helps my new associates as well. It helps my new associates to give them confidence. So there is a lot of seasoned dentists who will say, I don't need an AI. I think we all need it. We all need it because it becomes here again to support us. Let's talk next about the second part of the case acceptance and how AI can help us financials.
Oh yeah.
Because truly, there is a lot of patients that trust the dentist, and but really when it comes down to money, they will say, I have to go home and talk to my husband or talk to my wife. And I always remind that to everybody. Remember, we don't just talk to our patient.
Correct.
We are talking to their husbands. We are talking to their wives. So how fabulous if we can create a quick treatment plan and a summary of treatment plan in an easy language and send it home to the patient. I love what AI can do.
Yeah.
So imagine this. You treatment plan a treatment plan. You create a treatment plan and you upload it into AI. You can simply just save most treatment plans from most softwares can be saved as a PDF.
Right.
And you upload it into AI. You can use a ChatGPT. That's it. And you can tell ChatGPT, create a summary of this treatment. Don't include ADA codes. Make it easy to understand. And for patient wanting to complete this treatment. It will take less than 40 seconds to create a treatment plan that our human team would never be able to do that quickly.
Right.
And patients love that clarity. They love that transparency. And then they can take it back to their home, to their wife, to their husbands, to their mom, to their dad. And that's really helps to increase the case acceptance as well. That really helps to gain the trust and have the transparency. So now we have AI. Really, right now, AI is helping us to show the treatment to the patients via AI diagnostic tools. And then AI can help us to create treatment plans that are friendly and easy to understand.
So let's put this all together with what's happening right now with AI. So right now, help you diagnose, okay? Help a patient feel more comfortable in what you're telling them. It can help empower your hygienist. It can help make a younger or newer associate dentist feel more confident in what they're doing. And it can help you close the deal financially because it can help you save time in how you put together a financial treatment plan. So am I missing anything?
No, this is exactly what can happen starting today. Let's talk about what's going to be next in the next year, in the next 12 months, maybe next 24 months. AI will be able to educate your patient as well. Let's say you're a smaller office. You will be able to have an AI avatar that will educate your patients about the need. And that avatar will maybe look like your clinical assistant or your hygienist. You can, and it will speak in a friendly, human, soft voice and actually show the problem, the consequences of a problem, what can happen that is custom made to your patient. That is going to happen.
I love it.
And then another thing that will happen very soon, that AI will be able to analyze x-rays and create a treatment plan again that is accustomed to your patient, but also it can predict, hey, if you don't do this is what will happen in the next few years. So it's going to be a lot of, not only AI will be able to educate our patients really well, but it will be able to explain based on the predictive analysis what will happen to the patient if the treatment is not completed. Not only that, then it will be able to calculate all the fees, call on insurance, create a treatment plan with all the fees, and follow up with the patient as well when the patient doesn't complete the treatment. All of that is going to be here in 12 to 24 months. How crazy is that?
I'm going to hold you to that. 12 to 24 months. If not, I'm going to hold you personally responsible.
You will. I will be here. I don't want to say it will be here faster, but 2025 is a year of AI agents working together. And really, I wouldn't be surprised if it's sooner, but I wouldn't be too optimistic. I would say 12 to 24 months. That's where we're looking for that AI to get to that level.
I think this is great. So here's what's happening. So one of the things, and we're talking about case acceptance, and I'm glad we talked about what AI is doing and will be doing, but one of the things we have to understand is that case acceptance is unique to you and your practice. And it's not just a numbers game, it's a quality game, meaning that we can talk about raising your case acceptance. I know there's an industry average of about 40% or a little under 40%, but even that, if you're above or below that number, that could have to do with, the type of dentistry you do and the type of cases that you're presenting. So I don't even want you to think about the number per se. I really want you to think about, if you're watching this, the quality of your case acceptance processes, how easy it is, and how much it reduces stress. So, a lot of what we're talking about with AI, and this is good because we're talking about what it technically does, the actual problem it solves on the front end. But I'm always about the additional things, like I say, that don't show up on the stat sheet. Anything that reduces stress in a dental office is invaluable, because I don't know many professions that have as much stress, inherent stress, as dentistry. So how's that worked for you? Like, what have you seen from when you didn't have these tools to when you had these tools in the stress department?
Well, the case acceptance, anytime, time management, and really taking more away from the team and giving them more support. Again, I'm a big believer our teams need to be supported.
Yeah.
Our doctors need to be supported. Our hygienists need to be supported. Our business teams need to be supported. There is just not enough support in a dental office and too many jobs. So again, given that time and given that support is so important, and given that that's what AI does. It gives us time and it gives us that needed support. And that's why I love AI so much. That's why I fall in love with the AI, because I have never felt more supported ever in my life.
I love it.
That's really, and again, is my to-do list became smaller? No, it's not. But the things that I get done now, if it's used to take me 4 hours per project, it takes me 20 minutes. That's how crazy it is.
How much time do you think an average office could save implementing just one AI tool like just for case acceptance? If they just use AI for case acceptance, both diagnosing and prescribe and putting together treatment plans, how much time could a practice save? And that might be a hard question to answer, but just throw something. I
wouldn't talk about AI diagnostics, because that does take time. You still have to look at the X-rays. Okay. You still have to look at the treatment plan. Putting treatment plans together, hours of saved time, because again, humans cannot do what an AI can do. It would blow your mind away to see what AI will come up with as a treatment plan. Every time I show it to the dental teams, they get blown away, because up to now and my whole career, if the team had to create a second consult or a treatment plan, it was always like this difficult task to do.
Right.
And now it truly takes 30 seconds relying on AI.
Wow.
So, and it's more powerful than anything I was able to create before. And again, if I don't find it powerful, I can just tell it quickly, hey, change this, or, update this, or make it more human, or make it easier to understand. And here, 30 seconds later, I have a different version of a unbelievably powerful, easy to understand treatment plan. And so hours of saved time on doing that.
This is something everyone should be incorporating in their practice yesterday. So before we go, what is the one thing every single dentist should do right now regarding case acceptance?
Add AI diagnostics. Add some, from what we have right now, add control cameras. That's really easy to add, because not everything can be seen on the AI. So really add in an control camera and add in AI for diagnostics. That would be wonderful. And just start speaking to patients in a simple language that they can understand.
Sounds very good. Listen, everybody, this has been Intelligent Conversations. Dr. Kathryn Alderman, Brandon Hill. Can't wait to talk to you again. What are we going to talk about next time?
I think we really need to talk about implementing AI in offices. Even though we're so excited with you about AI and what AI can do for our teams, implementing it is not easy. And we will talk about why it's not easy, and what is the best way to bring AI to your office.
Stay tuned, everybody. Great talking to you as always.
Bye.